Joining me now is Assistant Professor at the NYU School of Medicine, Dr. Devi and Editor-in-Chief of Vox.com, Ezra Klein. Dr. Let's talk first about Tom Frieden, who is most certainly in the hot seat today. First of all, is this a good use of Tom Frieden's time, to be sitting on the Hill for 4 hours in the middle of, I'm going to call it a health crisis, because it's certainly not an epidemic here?
Well, I'm not sure that it's the best use of his time, but at least he's updating the public, updating Congress about what's happening. And I think he's done a great job of doing that so far. I mean, people seem to be aware of Ebola and the threats. I mean, the areas that I think are more concerning, you know, if we think about the spread of Ebola, of course, we're not doing as well as even West Africa. I mean, they have protected their healthcare workers. But on the other hand, if we look at,
I mean, in fairness, there are lots of healthcare workers that have perished in West Africa.
No, that's true. But if you look at the percentage of people who've actually contracted Ebola compared to the number of healthcare workers, you know, they are doing a little bit better than we are. But in other things, in terms of mortality, patients who've got Ebola, we're doing a lot better. I mean, the rate that the World Health Organization is talking about is 70%, whereas here in the United States, we've had only 1 death. I mean, 1 death is significant, but still, comparatively, we're doing a lot better.
Ezra, you know, 4 hours of hearings, it's hard to get something sort of tangible out of a line of questioning that's more, I think, for security theater than actually getting to an answer. But in terms of Tom Frieden and his management here, some folks have applauded the fact that he said, we've made mistakes. Other folks have said he's not been tenacious enough and transparent enough. How do you grade his handling of this thus far?
Dr. Frieden is not a person I would ever associate with not being tenacious enough. That, I think, is not one of the qualities he lacks. In terms of the broad questions here, so there is a real problem in Dallas Presbyterian. They've done a bad job managing the treatment of Duncan, and you can argue how much CDC oversight there should have been. I think at this point, certainly with hindsight being 2020, there should have been more. But this was not legitimately, these folks do not come to the CDC and get treated there. There's a question of how much do you want to hold the CDC responsible for any failure that happens in any hospital in America. The bigger question has to do with the overall nature of the CDC's response.
Yeah, I got to interrupt you, though, because, you know, to play devil's advocate here, this wasn't just should the CDC be involved in any sort of hospital response in America. This was, here we have a mishandling, a misdiagnosis of the country's first, you know, domestically diagnosed Ebola virus victim, I'll call him, and the CDC did not send anybody to Texas to maybe help manage his treatment.
Well, I think there's an argument for the SWAT team approach we're talking about, but one thing that we do need to, I think, be clear about, rewinding to about a week or two in the crisis, is that there is a known treatment protocol for how to do this. It was extended to everyone. It's been used before for a lot of different kinds of infectious diseases, and I think that before this began to spread in America, the belief among health professionals was that it would be reasonably easily contained using the methods that have worked in a dozen or a half dozen Ebola outbreaks before. So this feels very different now than it did 2 weeks ago because mistakes were made. But if mistakes were not made, we'd be having a very, very different conversation here. And one problem with the healthcare system, right, is it is ultimately human beings. And this is ultimately, can you manage 21 different steps to take off your gown? That's it's a tough thing for people to never make a mistake from, but it is a hard thing to ensure a mistake will never be made from Washington or even to some degree on the ground if you're not dealing with one of the centers like at Emory that is very, very highly trained in this kind of thing.
Yeah, and Ezra brings up a really good point, Dr. Nonpiaparapo, which is the CDC guidelines have gotten even more stringent in the last 48 hours. The gear that has to be put on at this point has gotten even more cumbersome. And I wonder from a public health perspective, I mean, there's so much fear and fear-mongering about this. You know, what do you see as the sort of medium-term effects of this kind of scare on our public health preparedness? Certainly we're more alert and alarmed, but is it a good thing to have this, you know, sort of really, I'll call it all hands on deck approach to something that is not nearly as contagious as many other sicknesses?
Well, I agree. I mean, I think we're asking too much of all the different hospitals. They have too many patients to take care of, too many things to think about besides just Ebola. I think it would make more sense to do this actually closer to the front line. So if a patient who's coming from West Africa, a patient who's been at high risk for something else, actually had a number at the CDC to call if they developed symptoms, then a very, you know, tailored team could come and check them out at their home as opposed to in the hospital where more people could get exposed.
Mm-hmm. Yeah, there's a lot of talk about quarantining and travel bans, and what was amazing today was, you know, numerous times we have heard, I mean, not even more than numerous, uncountable number of times we have heard that travel bans are a really bad idea if we want to prevent this epidemic from spreading. And yet, over and over and over again, Dr. Frieden was asked by mostly Republican members of the House, why don't you recommend to the president a travel ban, which is the intersection of politics and policy. And in this case, it is a very, very bad intersection.
Yeah, there's a danger here when Congress is getting pressure to do something, but there's nothing all that good for them to do, or at least nothing that looks all that good for them to do. And travel bans are one of the things that comes out of that. The simple reason travel bans are a problem is the way Ebola becomes really dangerous, even to folks here, is that the West Africa, its rampage in West Africa becomes totally out of control, and it spreads to places like India, to other parts of Africa. It gets on more planes. Ebola can be managed at reasonably limited numbers. It gets much harder the more people have it. And what you need to do to stop Ebola is to trace contacts. When you have a travel ban, when you begin to lock people in place, they begin to travel unnoticed. They flee, basically, and then you can't track their contacts, and then you don't know where Ebola is.
One more question, Dr. Devi, in terms of what happens next. Researchers at Northwestern say more than 24 cases of Ebola could be in the U.S. by next month, purely on a sort of preparedness, on the preparedness front, in terms of having the correct gear, the right sort of questions to ask, and the right training of medical professionals. Do you think we are ready? Do you think that the mistakes have actually taught us a lesson? We're more prepared, or is there still a real question about how prepared the nation is?
Well, I think in some sense, making mistakes does make you prepared because you see where the problem is and you can adjust to it. But we have to be sure that people are adjusting to it, which we're not, because the patients are being treated in a variety of different settings. So that's a concern. And then also, now it's not just people coming from West Africa, right? We have people here who are exposed, right. So it's a little harder to tell who's at high risk.
Right. It is an ongoing and fluid situation. Dr. Devi Parampal, thanks as always. Ezra, hang with me, if you will. After the break, the shameless politics of fear-mongering, how the GOP is trying to use Ebola to score political points against President Obama.